Good afternoon, everyone, and welcome to this week's CIFAR webinar on Science is the Exit Strategy. This is a series of virtual talks that we're hosting to showcase how research from across disciplines, from computer science to population and public health, economics and anthropology, can help to inform our public health and economic response in the wake of COVID-19. If you don't know us, CIFAR is a Canadian-based global research organization, and our mission and mandate really are to bring the world's top researchers together from around the world and across disciplines to address important questions facing society. Like many others across the globe, CIFAR has pivoted quickly to take action on COVID-19. We've launched many new projects, new initiatives, and we're highlighting those through this series. My name is Elissa Strome. I'm the Executive Director of the Pan-Canadian AI Strategy and the Associate Vice President Research at CIFAR. It's my distinct pleasure today to introduce you to Professor Kim McGrail. She is a professor at UBC in the School of Population and Public Health and the Center for Health Services and Policy Research. She is Director of Research with UBC Health. She is Scientific Director of Population Health Data BC, and I think most relevant to our conversation today, she is Scientific Director of Health Data Research Network Canada. Welcome, Kim. Thank you for joining us. Before we begin today's session, I want to take care of a few housekeeping issues. There goes a truck outside the window. Today's session will last approximately 30 minutes. Kim and I will have a conversation and then we'll gladly open it up to your questions. Please send those questions in through the Q&A function and we'll do our best to answer as many of them as possible at the end of our conversation. This session is being recorded and will be available on the CIFAR website next week. So let's jump right in. Kim, thanks again for joining us today. It's great to have this opportunity to talk to you about the work that you and your colleagues are doing at Health Data Research Network Canada to coordinate and integrate data across the country to advance health research. Let's start the conversation by having you describe a little bit about HDRN Canada, including its vision and its partnership model.
Great. Thanks for the opportunity. It's great to have this conversation with you today. So Health Data Research Network Canada is a newly incorporated not-for-profit, and it's a pan-Canadian network that is meant to facilitate and accelerate multi-jurisdictional research. So our network includes data centers and other organizations representing all provinces and Northwest Territory, and we're working on bringing in Nunavut and Yukon as well, plus Statistics Canada and the Canadian Institute for Health Information, or CIHI. The starting position of our network, and the reason we started working together over 5 years ago, well before we had any funding to actually do the kind of work we're doing now, is that we really looked across the country and see that we have this position in the world of data where the glass really is 3/4 full. We've got lots of strength in our at the national level and in our individual provinces and territories, but a lot of difficulty in actually doing a good deal of multi-jurisdictional research. And we really felt that if we had just the ability to add a little bit more, we could leverage all of those great existing resources and really promote a lot of more innovative research. So we're a distributed network, and we have a commitment to distributing funding. We're not creating something central. We're not trying to create a single database across the country. And part of that is because we have a principle of respecting local context and local policies and taking comers as they come without demanding that they act a certain way or be a certain thing in order to be part of our network. And we're leveraging wherever possible. So we're not trying to build something new if something excellent already exists in the world of data resources and access and so on. So just very briefly, we have 7 objectives overall for our network. One is to create a data access support system to help navigate multi-jurisdictional researchers. So it's one-stop shopping, one form, one request process. We're working to harmonize and validate definitions for important chronic diseases and other variables so we can have apples to apples comparisons of data across the country. We're continuing to expand the types of data that are available. Our bedrock really is administrative data, population-based information, but we can link that to cohorts, to surveys, to electronic medical records and other things as they become available. We're developing technology infrastructure to improve the request process. but also documentation storage, metadata, and other things really, and this is an eye towards sustainability of the network and the functions. We're creating supports for advanced analytics and infrastructure for data analysis, and really focusing there on distributed data analysis, because we know this is one of the ways of the future. We're establishing really strong partnerships with patients, the public, and Indigenous communities, and this is really around underlining the ethics of data use, particularly as data resources are changing so much, and building strong governance to enable national coordination, ways of working together that we have the strength from everybody. So you can see that our work really is around organizing and making data available, the technical supports around that, and really a strong focus on ethics and engagement, and then of course transparency and sustainability.
It's an amazing initiative, and it's so incredibly foundational to our ability to really analyze and assess and understand the impact on health of Canadians across the country. And the work that you're doing is clearly a huge step forward from where we have been in the past. So just so that we understand it a little bit more deeply. So through HDRN, researchers can access data from across provinces and territories, from across different health systems, and even across different data holders like Statistics Canada. As I said, it's a huge step forward. And so tell us a little bit about what are the key advantages for researchers to having this kind of broad multi-jurisdictional access. Why have we not been able to do that in the past? And what are the remaining challenges that you're tackling?
Yeah, great question. So I'll start with why this has been so difficult. And I really want to start there by acknowledging that not everything is difficult. Some things have really been done quite well. So CIFAR has a number of pan-Canadian data sets that are available and have been available to researchers for quite some time. And Statistics Canada clearly has amazing and rich data resources and a research data center network that has helped researchers get access to those. And of course, a number of provinces have really good data and support for access to those as well. But having said that, it has been absolutely a really big challenge and really a loss to all of us that we haven't been able to conduct all of the multi-jurisdictional research that researchers are trying to propose and put forward, and pan-Canadian projects that extend really just beyond the data of a single organization. That's where we really struggle, is working together across organizations. I think there's two kind of fundamental reasons for this. One is the nature of our Canadian Federation, and the tension that kind of sets up between provinces and territories and the federal government. And I mean, that's a whole political science conversation, but I do think it's important to acknowledge that is part of what's going on here. The other is that because provinces and territories have the individual responsibility for delivery of healthcare and other kinds of services, the data they collect, the way that they're collected, the technical systems that they use to collect the data, even the services that are covered are different. And this really creates a challenge for, again, the apples to apples comparison, but also the ability just to assemble and then use the data appropriately. So having said all that, the advantages that come from addressing this, it really are that we can look at the effect. It's a natural laboratory in Canada. We have different policies and different practices, so we can learn from those if we can compare across jurisdictions. We can also at a national level look at the effects of small populations, small number of conditions, or people who have had a relatively unique service, and really at the pan-Canadian level for those small populations, it's the only way we can do some of this research. So we do still have lots of challenges, including sharing of data across boundaries. And at this point, I would also say that we really haven't had enough engagement with the public around the ethical issues of doing the kind of data linkage and analysis that we really want to do.
Great. So, and I know that you're working hard on that front, and you mentioned earlier the work that you do in engaging with Indigenous communities as well. One thing that just occurred to me as you were speaking, Kim, I wonder if one of the other advantages of integrating and coordinating access to data across the country, health data in particular across the country, is really being able to take like full advantage of the diversity of the population in Canada, which is distributed across the country. Do you see that as another advantage?
Oh, yes. I mean, and this is probably highlighted really with the COVID pandemic and a lot of the discussion that's been happening around vulnerable populations and communities, race-based data and that sort of thing. If you really want to be able to truly understand small populations, rural populations, certain kind of racial and ethnic minority populations, it's probably much better to have a larger group, a larger population, being the Canadian population, to start from in those cases.
Great. And I know, from the very beginning of the pandemic, HDRN, pivoted very quickly to say, what can we do specifically to understand and address COVID-19? What can we do to understand how it's affecting Canadians, how it's affecting health systems and the demand on health systems? Can you give us a couple of examples of what HDRN did to address COVID and is doing to address COVID, and also maybe some of the specific projects that researchers are leveraging the HDRN data network in order to address?
Yeah, we did recognize early on that there was a role for us, even in a starting point of sharing information, making researchers aware, and in one spot, similar to what we've done in other cases, of what data might be available in which provinces that could support COVID research. Now, in the first instance, that meant documenting where COVID testing data were going to be available for research access and what other kinds of data sets that those could be linked to. And so we started, we put together, it was weekly at first, and we've gone to a little bit more less frequent updating of a briefing note just to describe where we are, the new features that are available. And just more recently, I think it's just today that came out, we have been working on metadata for the COVID data. And in the coming months, I expect that we'll be increasing focus on the other data sets that we might be able to link as we start to think about research on the broader effects of COVID beyond the people who've had have had the virus, to thinking about the broader effects on communities and individuals. And at this point, of course, there's no projects that have gone through the whole process and been completed through the HDRN supports, but we've been working with a lot of researchers on pursuing potential topics or studies they might want to do, and working with some specific ones on funded projects now, ranging from emergency department use. And in that case, we're working with a team that's actually assembling a new data set that will be available to others as well, to virtual care, reproductive care, and pregnancy outcomes. So there's a wide range of things.
Sort of the full spectrum of what we can do with the data that we have. I know as a sort of an interested stakeholder in the ecosystem, I've really appreciated getting your COVID-19 briefing notes on a regular basis to just maintain my awareness about what's going on and what's available for researchers, so that I can share it amongst my community as well. So I think we're just about ready to head into questions. So I just want to let the audience know that we'll head to questions after our next topic of discussion. So if you've got questions, please put them into the Q&A box for us, and we'll get to them right away. But the last topic that I want to touch on sort of formally with Kim is the fact that over the last year, she and I have worked together and had the opportunity to work with 15 other leaders from across the AI and health research innovation ecosystems in a national AI4Health Task Force. And what we've been doing is developing a series of recommendations to both the federal government and provincial and territorial governments towards a national AI4Health strategy. The report of the AI4Health Task Force, which we've titled Building a Learning Health System for Canadians, is now available on the CIFAR website. So Kim, let's hear from you a little bit about why you think it's so important that we have a national strategy on AI for health and how it will deliver benefits to Canadians.
We really appreciate being able to talk about this, because it was such a pleasure to work as part of that task force, and you produced a fantastic report. So congratulations on that. So I mean, I think it's important to start just from the basics of AI, and just my perspective on this is AI has, like many technologies, probably like any technology at all, has a great potential for good, but equally can be used to produce harm, and it could be unintended consequences, but still harm. In addition, AI is one of the drivers as what has been described as the fourth industrial revolution. And if we kind of summarize what I think people are talking about when they say this, is it's this kind of continuation of the digital revolution that's kind of starting to blur the distinctions between, or to kind of combine physical, biological, and computing kind of processes. So man and machine kind of a framework of things. So in other words, it's expected that AI is going to be really disruptive to business, to government, to governance, and to our daily lives. And if we believe this, then I think it's really important that we have a coordinated strategy, first of all, to make sure that we truly understand what's happening, and both the unintended and intended consequences, and that we have a handle on how best to make sure that we get good things out of AI. And secondly, that we mitigate any negative consequences if we are able to do so. So then if we think more specifically about health and the healthcare system, in Canada, it makes sense for us to focus on health in part. I mean, we have a ongoing, abiding respect and love for our universal healthcare system with all its imperfections. It is still a great building block, and hopefully we can continue to make improvements in that. The AI approaches in health can accommodate a large amount of data, including images. They can help us make sense of this vast quantity of information. It can improve efficiency in diagnostics. And AI systems can be used to augment human activities. So they can help make providers provide better services, but they also could do things like help people live in their homes for longer, and augment those informal and formal supports as people age. So ultimately, I think we need a pan-Canadian strategy in AI for health, because it is a disruptive potential of this technology, because of the changes in the infrastructure that are needed for AI are significant, and because AI in health is ultimately a global issue. And if we want to have some influence on that at a global level, we need to work in a pan-Canadian way.
Yeah, absolutely. I think, on that last point, one of the things that we discussed a lot at the task force, of course, we talked a lot about data and data access, you'll recall, and other members of the task force I see are on this webinar in the audience today. We spent an inordinate amount of time talking about data and data access. And, the pandemic has really actually allowed us as a research and innovation community to make some important steps. And HDRN has really been leading the way on that. But the other thing that we spent a lot of time talking about at the task force was really, Canada's opportunity around the application of AI to health, and our specific opportunity, because we are, a great leading AI nation. We have tremendous expertise in this field across the country. Because we have such strong values around AI and its use in a responsible and ethical manner, and especially when we're talking about health and when we're talking about personal data, those principles and values are so incredibly crucial. But also the opportunity, to really leverage that publicly funded health system that we have, and the fact that the data is and should be and can be made available for research and innovation. So, it was such a wide-ranging conversation, and we probably could have had 100 recommendations in our report, and we worked so hard to really narrow them down on the focus of the things that we felt as a committee were essential first steps in moving Canada forward to really take advantage of all of this, and bottom line being, better health for Canadians. I think that's the vision of the task force. So thanks to you for all of your contributions to that work. And as I said, we've got a couple of members of the task force I can see are on our participant list today. So thanks to everybody for their efforts. So let's move to the audience questions now. And we'll start with a quick one, actually, from Randy Gable, colleague of ours on the task force from the University of Alberta, and from Amy, our AI Institute in Edmonton. Really quick question. Randy asks, is there an URL that provides information about research access to health systems COVID test data? Randy, I think what you're asking for is how do you find out what data is available about COVID testing through HDRN? And the answer to that is you can go to the HDRN website, and it's all on there, and look for their briefs as well. And the brief today actually speaks to the metadata that's available. Okay, so another question that's come in. The participant asks, what are the most expected worries regarding data sharing from the population and data owners? So really the concern that citizens have and the concerns that the public have about data sharing. Can you outline some of that for us, Kim, please?
Sure. This is it's a difficult question to answer, in part because I don't want to pretend to speak on behalf of all Canadians. What I can speak to is the existing literature that has resulted from a pretty deep public deliberation, including focus groups, but longer deliberation sessions as well. And I have been leading some of those in British Columbia, but there's a international group of people who've been working in this area. And interestingly, there's quite a lot of consistency across countries from what we can see in this. So people are really, really open to having their data used for research. But it's always in context with provisos, and those provisos really revolve around the 5 safes framework. And this is a framework that's been emerging as just, it doesn't say what needs to be done, but it tells you what you need to think about. And what those things are is safe people. So who is it that's accessing the data? And people have a lot of trust for researchers, university-based researchers. They start to get a little more concerned if we're talking about private industry. And it's not, I don't want to say that it's a hard no, it's just that it changes the conversation a bit, and there's different considerations. So safe people is a big one. Safe environments, where are you going to be doing the research? And increasingly people expect things to be done in a controlled, secure environment, because that just says that you've got greater control over what's happening. Safe projects. So what is the question that's being asked, and who's vetted it to say that it has scientific merit and will produce some public value? Safe data. So this is the how identifying are the data that are going to be used, and have things been done to at least remove direct identifiers, names and addresses and things like that. And safe outputs. What's coming out? What's going to be shared publicly? Is there potential for harm to come to individuals or communities, small populations based on that? So those are the things that the public worries about, less blanket or strict yes or no, and more what's being done to protect data and put some guardrails around use.
Great. And that 5 safes framework I found in researching this field and working on the task force was really such an excellent conceptual model to think about what are the things that we have to be concerned about? What are the questions that we need to be asking ourselves as researchers as we're considering the use of individual data. So along the same lines, we have a question that came in from another one of our participants about the type of work that you're doing around community, public, and patient engagement. So he asks you to speak more to community patient engagement in the HDRN and how that interfaces with the idea that individual participant consent is not required in studies of administrative data. Thank you, he says.
Yeah, great question, because of course, again, the bedrock, not all of the data that we have is this, what we call unconsented data, but a big portion of it is. And they're unconsented in the sense that there's allowances for use of these data in the absence of consent, again, with the guardrails around that. So when we are talking about public and patient engagement in Health Data Research Network Canada, we're really focusing on data specifically, and I contrast that with the broader strategy for patient-oriented research from CIFAR, which is what we're funded under. So we're not. So this really is a focus on how are we going to use data? What kind of data should we be bringing in, and what are the limits to allowances for research uses of that information? So we have established an interim public advisory council for HDR, and we're just in the process of recruiting and filling out a permanent structure for that. And we will be looking to that group for helping us with a number of things. One is communication. So we really feel that transparency is kind of the first order of business for the activities that HDRN is doing. But another is really to help truly create a space where the public has an influence on the policies around data use. And then I think we will absolutely take direction from that advisory committee on other things that we should be considering, whether that's about information flows or about doing things differently. And I do want to emphasize that I personally feel very committed to the fact that the public needs to have a true say in this. This is not just a PR communications exercise.
Absolutely. And it can't be tokenism in any way. It has to be really deep engagement, consideration, collaboration with the public and with patients. And we articulated that very strongly in the task force report, very much taking inspiration from the work that you've done at HDRN and that others have done across the country on this topic, really thinking about the role of citizens in understanding and contributing to this work going forward. I was always inspired by the UK, where they seem to have a very strong culture of data trust. And I think that's something that we can learn a lot from and aspire to build in Canada, this culture of inclusion within the governance, within decision-making around data. And that's how you engender trust and how you're able to advance research objectives. Another couple of quick questions about HDRN. Another colleague asks, are there any plans to reach out beyond our boundaries to coordinate with other countries?
Yes, as a matter of fact, we have a partnership around COVID with the UK Health Data Research Group, and we're working on a memorandum of understanding for larger work with them. In fact, we're working with them on metadata now because with the idea being that metadata being how we describe the data that we have, if we can align metadata, then we are effectively aligning the potential for international collaborative research projects. So we're working with them so that we can get those things in place now.
Okay, such a great partner for us because they have so many similarities in their health system, in their principles, values, democracy, and have been a real leader in this space. So I think the UK is always a great example to look to.
Yep.
Last question about HDRN, and then we'll start to wrap up. For provinces who are looking to build their own internal capacity for data collection and sharing, can or does the HDRN assist them in accelerating those improvements?
Oh, it's such a great question. Yeah, it's one of the things that we have found over the last couple of years of really working together more formally. It's one of the greatest assets we can provide is all the learning and information from the existing centers to share with those who are trying to start up. But honestly, equally, it goes in the other direction as well. So we have established, for example, a privacy working group of all the privacy leads from our organizations across the country, and they're helping to do a number of things on a legislative review and that sort of thing. So absolutely, those resources are there, and we're really open to helping as we can.
Awesome. So this has been a fabulous conversation. Thank you, Kim, for joining me today. It's been gone by very quickly, as these always do, and I'm afraid we don't have time for any further questions. I want to remind the audience that the AI4Health Task Force report is now available on the CIFAR website. And before you sign off, I'd like to thank everybody for joining us today for this conversation, and I'd especially like to thank you, Kim, for telling us the story of HDRN Canada and the amazing foundation that it has laid to integrate and coordinate data across the country and make it available for research. CIFAR's virtual talk series continues on August 20th with CIFAR President Dr. Alan Bernstein in conversation with Professor Arturo Casadeval from the Johns Hopkins School of Medicine, and he's doing groundbreaking work on the use of plasma for the prevention and therapy of COVID-19. I hope that you can join us then. Please visit our website, cifar.ca, to find out more about the series and to view a recording from today's talk, which will be posted early next week. Thanks again to everybody for joining us, and have a wonderful afternoon. Bye-bye.